Breast density is a composite of what our breast tissue looks like on a mammogram. And different women have a different amount of different types of tissue in their breast. Breast tissue density does have a significant role in the ability to detect early breast cancer. If a woman has a small cancer that is white, that has the same characteristics on the mammogram as normal fibrous tissue, it will make it much more difficult for us to see that cancer. Breast tissue density has been always a very subjective measurement. Radiologists will look at the mammogram and decide how dense that mammogram appears to them just by their own subjective measurement. If we are going to decide that a woman needs additional imaging based on their breast tissue density, it would be far more helpful if we could have an objective measurement that allowed us to be consistent from time to time, mammogram to mammogram, radiologist to radiologist, to decide that that specific woman needs another test or not. I think that utilizing the Volpara software in the breast screening process will not only make things more consistent for the radiologist, but more accurate for the patient involved. If we are basing our decision to do additional imaging on our own subjective measurement, we may be either including women who don't really need to have additional imaging done or excluding women who do need to have it done. Computer-driven breast density calculation will allow the radiologist to triage patients for additional imaging. And certainly, if this becomes more accepted around the country, that these women with higher breast tissue density get additional imaging, I think we're seeing that we are finding more cancers in these patients, and that these cancers are small and low stage and easy to treat. There are certain advantages for a woman to be aware of what her breast tissue density is, because they then can decide whether or not they should approach having additional imaging to either reassure them that they have no problem going on, or whether or not there is a problem that needs to be addressed.